Hi, this is Dr. Lamb here. I'm talking about high ankle sprains. Now, from these Alabama football players, there's been a lot of press about high ankle sprains. What is it? Let me explain it. We've been dealing with high ankle sprains for a very long time, and I would say, one of the most neglected sprains that we tend to see. Uh, so the high ankle sprain, what is it? Let me explain it with a ankle model. Well, okay, this way. So obviously we have the lateral ankle ligaments right here. Lateral meaning outside on the fibula side. You have three ankle ligaments on the fibula side. You have one, two, and three. This is the most common side that's sprained. When you sprain your ankle ligament, that's what is sprained. One, two, and three. Okay. The more common one being the front one, middle, and then the last one is the one in the back. So these are three ankle ligaments right here on the outside. That's called the lateral. Lateral meaning that is on the outside. Now, this side is the deltoid ligament. This is very, very strong. On this side, it's on the medial malleolus, which is the big bone, the tibia side. Very strong. We see that being compromised in sports injury, but a lot of time we see that in flat foot deformity, where the tendon gives out and you're depending on the ankle ligament to hold you together. So let's move on to the high ankle sprain. What is it? One other set of ankle ligament that we did not talk about right here. This is called syndesmosis, the connection between the tibia and the fibula. Not talked about a lot. We see this in specialty care. We see this in ankle fractures where the ankle goes out this way. So you can see when it goes like this, it wedges the two bones apart, acts almost like a wedge, and breaks these two bones apart, and it tears this membrane all the way up. So you have a couple of ligaments, three ligaments in here, and then you have a membrane going all the way up the leg. And sometimes we see with what we call pronatory eversion, where we go out, pronatory eversion going out type of injury. This is going in type of injury, going out type of injury, going like this. See if I can show it to the camera. Like this, it wedges. So you can see the talus bone, which is this bone right here, causing a wedge, pushing this bone apart, basically. Okay. And that's how you get that kind of fracture pattern. Or if you just a sprain, same exact thing, going out, causing that sprain, causing these two ligaments to spread apart. These two bones spread apart. That's what a high ankle sprain is. It's been getting a lot of press because now we're dealing with football players. And now, uh, you know, very important games, and they have these high ankle sprains. So what is it? That's what it is. Now, how do we fix it? Now, the old days we put screws across it. I mean, sometimes we still put screws across it, but you put a screw across there and you hold these two bones together, and these ligaments typically scar down. I mean, we don't make new ankle ligaments for you within these two bones. A lot of times they scar down as long as we hold it in position. So we put a clamp on these two bones, and then we put a screw right through it. Or in the case of these two football players, how we get them back on their feet again quicker, we stick what we call fiber tightrope, made of fiber wire tightrope, basically two buttons and a very, very heavy uh, wire. It's called fiber wire. Very, very strong to act as a fixation point between the two buttons to hold these two bones together. Now, the whole point of that is the reason why we use those buttons and that flexible wire instead of a hard titanium screw, they allow flexibility. That flexibility allows the tibia and fibula to move back and forth. Now, it's not fixed like this. And anatomy is not fixed like this. There's constant motion between them. Very small motion, but there's constant motion between these two bones. That's why the fiber wire along the tightrope by Arthrex comes in handy because it allows the movement, but yet it does not allow for separation of the tibia and the fibula. And that's why these football players are able to get back on their feet a lot quicker because we're not afraid of them going on their feet and ankle because the tightrope itself, the button on each side, one on this side and one on this side, with this wire, or we call fiber wire, basically is almost like a Kevlar type of fixation wire that is almost indestructible. I said almost, I've broken one before. Made it to two buttons on each side to hold these two bones together so the tibia and fibula stays together while it still allows this motion, the shearing motion back and forth. So back in days when we used to put the screws in, they say, hey, don't weight bear for about 8, 9, 12 weeks, just so the ligaments can scar down. So you do not have the separation or the shearing forces. You want it steady so that ligaments can scar down. Now with the fiber wire, the reason why we're getting them back up to speed faster for young active patients, pro athletes, etc., because it still allows this compression right here, but It still allows stable compression with the wire and the two buttons, but does not allow the motion back and forth. It allows the motion, take that back, allows the motion back and forth, but does not allow the separation to happen because of the two buttons and the flexible wire in between, the flexible tightrope in between. So that's what a high ankle sprain is, guys. We went through the lateral ankle ligament, which is on the outside, the medial deltoid ligament on the medial side, which is big bone, and now we're talking about a syndesmosis, high ankle sprain. That is high ankle sprain right here. You have three. You have the anterior, you have the central, and then you have the posterior. Same as on the lateral, anterior, middle, and a posterior, calcaneofibular. That's the actual name of it. Over here, we have three ligaments, one, and then there's one in the middle, and then there's one in the back, syndesmosis. So that's what a high ankle sprain is. Very, very often misdiagnosed, very often underdiagnosed. So how do you know? You have pain upon weight bearing. You have pain right here. On the X-ray, on a weight bearing X-ray, on a weight bearing CT scan, you'll see the separation of these two bones. Very subtle. A lot of time, only a specialist can really appreciate that separation. An MRI can help you, but mainly it is the weight bearing film, sometimes a stress film where we put the patient on the X-ray and we crank that ankle out to see it. Sometimes during surgery, when we're dealing with a fractured ankle, we check that syndesmosis, the high ankle sprain area. We really stress it to make sure that it doesn't separate. If it separates, fine, we put a screw or a fiber wire through it. Fiber wire made from Arthrex right here in Naples, guys. So any question, please comment below. Subscribe, comment, so that way I could come back with something that you guys hopefully understand and come back with a video that you guys want to hear. Let's see how this works, guys. Follow me on Facebook, Family Foot and Leg Centers, PA. Follow me on Instagram, Dr. Kevin Lamb, Dr. Kevin Lamb, LAM, no B. See you guys.